Now, there are nerves that control the muscles of the eye. Now, we're not talking about actually your sense of vision. Now, we're talking about how your eye moves, right? Like this way and crossing and all that stuff. So, there are three main nerves. So, oculomotor, trochlear, and the abducens. So, this is the way to remember it. 3, 4, 6. So, so common misconception and pitfall. They say 3, 4, 5, or they go 4, 5, 6. So I go 3, 4, skip 5, 6. So it's almost in a row, but not quite. Cranial nerve 5 is special. So oculomotor nerves, so CN3. So it's not about vision. Now it's about controlling the muscles of the eye. So the oculomotor nerves, these are the workhorses in terms of eye movement. Because why? They pretty much control all the muscles in your eye except for two. So here are a list of all the muscles they control. So again, you have all the rectus muscles in your eye, and intrinsic eye muscles will get covered when we get to the autonomic nervous system. Now, trochlear nerves. So this isn't controlled by cranial nerve 3. So this trochlear nerve, well, it controls the superior oblique eye muscles. So all of these we see here, these are the rectus muscles. But remember, oblique, when you have rectus, that means long, some sort of straight axis. Oblique tends to be diagonal or offset. So superior oblique is this one right here. But the trochlea itself, why is it called trochlea and not the superior oblique nerve? Well, this is a band of connective tissue that kind of anchors the superior oblique eye muscle. And this is called the trochlea. So that's why it's called cranial nerve 4. And in terms of its function, when you're moving or contracting this superior oblique eye muscle, it's counterintuitive at first, but it doesn't roll your eye up. It actually kind of like helps your eye look down and kind of go side to side. So like when you're reading, that's using your trochlear nerve and your superior oblique eye muscles. So yeah, that's your superior oblique. Now, this is my mnemonic for it. So how do you throw a knuckleball? And I mean, just think of it, like you're saying throw, but you're thinking of it as like a pigeon accent. So how do you throw a knuckleball? Well, one way you can throw it is with 4 fingers. So that's the way you think of it. You throw it with 4 fingers. So trochlear nerve is cranial nerve 4. All right, so skip cranial nerve 5. Again, it's not 3, 4, 5, 6. It is 3, 4, skip 5, then 6. And let's talk about the abducens. So its function is, now, it contracts the lateral rectus muscle. So here we're seeing a right eye. So it's going to move it laterally. So if it's your right eye, it's going to move it this way. And if it's the left eye, what it's going to do is going to move your left eye away from the midline and toward the left. So it depends on which side, that determines which way that it moves. So if you somehow manage to just contract the abducens by itself, your eyes would go cockeyed. It would go towards the opposite side. All right, so lateral rectus use. So one of it is moving your eyes to the lateral way. So things like that, right? So this guy's you looking off to the side, and this is you. This is your friend who didn't study, and there's someone else who didn't study. They're looking like that. But what if people want to cheat without being obvious? Well, they're instead of like turning their whole head like this guy right here, they're going to look off to the side, right? So another way to think of it is a mnemonic. So I like to think of that abducens as a side eye. The side eye muscle or side eye nerve that controls the lateral rectus that allows you to look to the side. So abducens. And abducens, another mnemonic is like what other muscle groups. So it's not the same thing as the abducens doesn't control your abdominals, but what's another slang term for abdominals? The 6-pack, right? So if side eye looking at someone with a nice 6-pack, so this is where I remember abducens is cranial nerve 6. So again, what would it look like if you're able to just contract just the abducens but nothing else?
Pumpkin.
Okay, so that's what it would look like if you're able to just move that, fire off that abducens and just control that lateral rectus muscle. That was before they have that special TikTok filter, but yeah, I was like, wow, that's a great example of the abducens. Okay, so now let's talk about nerves that control the eye. So again, 3, 4, skip 5, and 6. So ocular motor, This is how I memorize it. I basically use process of elimination. Trochlear, only that superior oblique. And then the abducens, only that lateral rectus, that side-eye muscle, right? So if it's not the superior oblique, if it's not the lateral rectus, it is cranial nerve 3. So that's why it gets the oculomotor. Again, oculo meaning eye, motor meaning contraction. So then the cranial nerve 3 controls pretty much everything that 4 and 6 don't control.